Good morning, Nashvillians. I'm pleased to be here to share some encouragement and some guidelines as we're seeking to deal with the stress and anxiety as we deal with COVID-19. It's impacting each and every one of us, from children to the older individuals. And one of the things we have are concerns that are out of our control. So it's important for us to focus on things that we do have control of. One of the things we can do are adopt healthy habits that will help us as we work towards emotional wellness. Some of these healthy habits include choosing to have a regular routine, choosing to have regular sleep habits, choosing to eat a large portion of fruits and vegetables in our regular diet, and of course, drinking lots of water, staying hydrated. Choosing to have regular physical activity. That can be walking outside, it can be walking inside, it can be moving in place as you sit or just move on your daily routine. Choosing to breathe deeply and relax, calm your nerves down, calm your respirations down, calm your heart rate down as we think about the different news items that come across the different media. And of course, choose to limit, and I stress, choose to limit the amount of news that we watch, that we listen to. We don't have to listen to every single news story or read every news bite that comes across social media. So these healthy habits can help us as we seek to adjust to a normal routine or establish a new normal. One of the things we do know is that accumulative stress makes a difference. For Nashvillians, we were already dealing with normal stressors of daily life, with coming and going, dropping people to different appointments, working, school routines, and then we had the tornado. Before we could recover from the tornado, we're now dealing with the coronavirus. And all of these stressors pile on little by little and make our anxiety more prominent. Many times we're feeling powerless, we're feeling that things are out of our control. So it's very important to pay attention to our internal state of mind. And again, we can make a choice to think about things in a positive way and think about things that will make us make good choices. As we monitor our internal emotional and mental state, we must be aware that some people may be experiencing more serious emotional and mental illnesses. How do we know that? We would know that if we have more difficulty in our daily routine in terms of concentrating, sleeping, if we are still working as healthcare providers, if we are unable to engage with our family members and interact with them in a calm and peaceful manner while we are at home. None of us are immune to depression and anxiety. Every one of us has a breaking point according to the stressors that we've experienced in the past and the stressors that we are dealing with now. According to the Centers of Disease Control, 50% of Americans, of all Americans, will be diagnosed with a mental illness or disorder throughout their lifetime. That's a significant amount of our population. Now, let me just remind you, these are not character problems that I'm talking about. These are medical problems, just as we might have problems with our lung or our stomachs, for example. Our brain is an important part of our body. So if you are experiencing some of these more serious difficulties, think about ways to cope by letting people around you know that you're under a lot of stress. There are some community resources that can provide support, and our mayor mentioned if you're in a particularly difficult or challenging situation while you're at home and more contained in an environment and interacting with people perhaps that you may not normally have interacted with on a long period of time, experiencing domestic violence, physical abuse, or even sexual abuse, you can call or text the domestic violence hotline. And that number again is 615 983 5170. If other individuals are experiencing crises in terms of a mental health crisis, emotional stress, there is help available through the Tennessee statewide crisis hotline, and that number is 855-CRISIS or 274 7471. We must take care of each other. So use your media to reach out and talk to people on the phone, text, Skype, your loved ones. Reach out to your community of faith for strength and support, for a sense of purpose during these uncertain times. We are all in this together, and as we look for a sense of peace and calmness, let me just remind you about our serenity prayer. God, grant us the serenity to accept the things we cannot change, courage to change the things that we can, and the wisdom to know the difference. Thank you.